So with the SimulEye models, we're actually a small company, but we have a big reach, and we've been able to do that through our corporate partners. So we work with all the biggest names in the industry to help support their needs. What I mean by that is companies like Alcon, Johnson & Johnson, Bausch and Lomb, and also the more mid-sized companies, below them in terms of size and scope, but still big impact into the residency training programs like MST, New World Medical, LX, Glaukos for sure, Allergan now, just on and on and on. All these big name companies that do so much with resident education and training surgeons that are also established surgeons. That's who we work with to help get our products out there to provide the most benefit. So those companies have the infrastructure to bring our products to the residents and the surgeons, and they do that because they're demonstrating their products. So they have their products that they are trying to educate on, train on, inform surgeons about, and we provide that training platform to help them demonstrate their products. So they have their natural infrastructure with the resident training programs across the nation, across the world. So that's how our eyes have gotten out there so much. That's really been kind of one of our key business models, is in being so small, that's how we have such a big reach. So for example, in the beginning days, I would have to identify a need, where's a model needed. So I would develop that model and I would take it to the company. Let's say with Alcon and the LensX, their Model I was really a problem in terms of my training, and I knew I could do it better, and so I worked and got it dialed in. And then when I took it to them, they were really impressed by it, and they've adopted it, and it's been on the showroom floors and out in the trainings. And we made a model to work with the J&J Catalyst, and also of course the Bausch Lomb Victus, and so just we've kind of covered that whole range. And then similarly, as MIGS has taken off, MIGS has been a huge part of our business because that whole revolution really needed a lot of support, not just for residents. In fact, that was geared more towards established surgeons out in the field, and these big companies took their devices out there, and so we partnered with them early on. Like New World Medical came to me and said, hey, can you make us a model so that we can help demonstrate the Cahook dual blade? And so I actually worked with Dr. Malik Cahook and gave him some prototypes of channels and trabecular meshwork and getting the blade to kind of excise that meshwork, and we got it dialed in, and then we put that into a model, and they took that model far and wide, and I believe that it really helped them demonstrate their product and bring a lot of value to the world outside of the U.S. even, because that's a product that brings so much value to the underserved communities in the world. From there, we just kind of grew with more and more companies, and now it's gotten to the point where we have these conversations earlier on with the companies and develop the models in conjunction with them so that the models can be there for release of the product. For example, like with Glaukos and the iStent Inject. I had the opportunity to work with Glaukos a long time ago with the original iStent, but we just never got the model dialed in for them. But when it came time for iStent Inject, they came to me and said, hey, we really want to have a robust model to teach and train on all the subtleties of iStent Inject. And so I worked with them in the OR after hours, hand in hand, to come up with the right materials and the right platform to get that done. And similarly, we're working with companies like Sontin as they're looking to develop new devices, or other companies behind the scenes. There's a lot of stuff that's in the R&D pipeline, and we get pulled into those discussions, which is fantastic, because it's great for the companies and for us, because we can be ready when that product's ready to launch. And when they launch it, they're going to get so much more value for their surgeons when they have a robust training device, a SimulEye, to launch that product with. And so again, as a small company, we are able to have a big reach by working with these fantastic corporate partners in the industry.